Hello, everyone. Happy Sunday. I'm Kira. Welcome back to NP Now's YouTube channel. I'm in a different space again today, but I'm here like I promised every Sunday. I'm going to be going live with a new video for you guys, particularly pertaining to anything practice-oriented or business-oriented, just to give you guys some tips, especially for my new graduate nurse practitioners that are just starting out. I want to come on to help you guys out with some things to help you begin practicing. So if this is your first time visiting my YouTube channel, I am Kira. I'm a family board certified nurse practitioner. I've been practicing for about 5 years, and I run NP Now, which is a consulting company geared towards helping nurse practitioners, mentoring, education, business savviness side of things, especially when you're starting out as a new graduate. And, I started this company, which I initially was consulting corporations for consulting with corporations initially, but now I just cater to the NPs, and it's just to basically help us out so I can try and help one nurse practitioner at a time to try to get us, good through those bumps and hurdles that we usually experience in the beginning of our practice. So today I'm talking about some different apps that I used when I first started off as a nurse practitioner that really kind of helped me in the beginning. And these apps are in no way to replace clinical practice. They're basically there to help supplement you. I know that there's some nurse practitioners who don't have someone that they can talk to that you can bring in the room maybe, and you're in a rural area, or for whatever reason, you just can't get on the phone and you need to look up something really quick. I have about 5 apps that were like my go-to when I was a first brand new grad. I was working in an urgent care, and I would just be seeing patients back to back. You really have no time to really think. So that's why in my online course, the NP Now's new graduate nurse practitioner navigator course, I have a list of the top 10 diagnoses that I recommend that you basically know according to your specialty. So for instance, if you are an urgent care nurse practitioner, I have like 10 diagnoses that you're going to see all the time. Otitis media, URIs, sinusitis, those go-to diagnoses that you already have in your head. You know what the signs and symptoms are, you know how to diagnose it, you know what the first line treatment is, and you know what the follow-up is. So if you get those down packed, then you'll be golden. But these apps are kind of like supplemental things in your practice to help you basically get to a diagnosis or get a medication dosage, or kind of, I have one app that is for x-rays, kind of get you comfortable with x-rays. So let me get into it. So my first app is UpToDate. Now, some of these are, 4 of the 5 are free. UpToDate is, of course, not the free one. UpToDate is kind of expensive. I think it's about $700 or $800 a year if you aren't affiliated with an organization that uses UpToDate. But I get it for free through my work, and it's an awesome app. On that app, and I wanted to show you guys what the app kind of looked like too. On that app, basically it gives you, you put the diagnosis in, and it gives you everything that you need to know about that diagnosis, from the treatment to the signs and symptoms, the etiology, everything. It's an awesome app, and it's backed by science and research, and almost every practitioner uses UpToDate. You probably used it when you were in school as well. So this is my phone here. Not sure if you can see it very well. It went off. Let's see. So this is my phone. I gotta get better at this YouTube thing, y'all. Let me see. UpToDate, the app is the icon. I wonder if I. All right, so. All right, so this is what the app looks like when you first log on. Try to get a better angle here. All right, so this is what the app looks like. So basically, let me just tell you about the app for right now. So this app, basically, all you do is put the diagnosis in that you need to find. You can go onto the Google Store or the Apple Store, look for the app by name, Up to Date, and it'll come right up. Downloading it is free, of course, but of course you need to log in, and that's paid. So with this app, all you basically do is in the search engine, you put in any diagnosis that you are looking to get. You can say abdominal pain. And when you bring up abdominal pain, it'll give you a list of all the things that come up abdominal pain, evaluation of the adult with abdominal pain, chronic abdominal pain, causes of abdominal pain, causes of acute abdominal pain in children, adolescents, whatever it is that you're looking for. So this app is so good when you need to figure out what the next line of treatment is, especially if you can't get to another provider or you can't call your collabo really quick, or you just want to like have a little bit of information to talk to them about to add to the to your list of diagnosis that you're thinking about, or maybe you want to ask the patients another, it'll prompt you to ask the patient another question that you didn't think of, like, oh, do you have this symptoms? All right, maybe we can rule this out, or do they have a positive Murphy sign, or, you know, things like that. But when you go to this app, it gives you everything you need: summary, introduction, goals of the evaluation, causes, evaluation of everything. It also has a section on it for medications as well. So if you put a medication in, say you were looking for Eliquis, then you can bring up Eliquis and it'll give you the dosages and things like that. So that's basically what Up to Date is. Up to Date is one of those staple apps that almost every practitioner has. It's not free, but it's definitely helpful. They also give you like the articles, the research articles. And what I like about this a lot is it gives you CEUs. So when you go to renew your certification, it keeps a log of all your CEUs so that you can go recertify. You just print a printout out and it gives you all the CEUs. I don't believe they give you pharmacology hours, but they do give you CMEs so that you can recertify every year. My next app that I like a lot is Epocrates. So say you figured out your diagnosis. This patient has sinusitis. Okay, I want to give Augmentin. How much Augmentin? So with Epocrates, this app, basically, I think that's better. I think I could see it better. The darker colors you could see, but these lighter colors, I can't really show you guys what the app looks like. I'm going to get better at this YouTubing so that I can like show you guys better pictures and things like that. So with Epocrates, basically, it's an app that looks like this icon here, a big old E. And all you have to do is put in Epocrates and it comes right up. So what Epocrates is, it comes up like this, where you can type in the medication up top, whatever the medication is. So if you want to do Augmentin, so I'm going to just put Augmentin in really quick and I'll tell you what it says. So Augmentin, say I want to give the patient Augmentin because I decided they have sinusitis and I'm going to give them Augmentin. It gives you an adult dose, a pediatric dose, gives you the contradictions and cautions, adverse reactions, drug interactions, which is another part I love about this. Safety, pregnancy, lactation, it goes over all of that. So if you click on adult dosing, it gives you the adult dosing for sinusitis, and it also gives you what else it could be used for. So some people use Augmentin for sinusitis. Some people use it for UTIs, pneumonia. It could be used for diverticulitis. So it's a really good app to have, and I still use this app along with Up to Date to this day. Another thing about Epocrates that I like a lot is the interaction check. So if you have a lot of patients who are polypharmacy, for instance, you have the elderly, they have 15 medications, you want to put them on a new one, type in all the drugs, it tells you what interactions are, what interacts with what. Now, I know a lot of the EMRs have this in it already, but say if you're I was working in a clinic when I first started out at one point, and we had paper. We didn't even have an EMR. So these apps came in handy for me. Another app that I like a lot, so Epocrates is free. Up to Date is not free. The next app I'm going to talk about is Medscape. That is free, and I like Medscape a lot. So with Medscape, that app, and it's spelled Medscape, MEDSCAPE. If you type that into the search in the App Store. So what I like about Medscape a lot is they give you a lot of articles, and they also give you CMEs, and they also have like they also will send you surveys if you do like different surveys, and they'll pay you. They've been paying you people in like Amazon gift cards. So if you sign up with Medscape and it's free, you get that benefit. You get some money. They send you a survey and you qualify for it, but they have lots of great articles. I love Medscape. They also do drugs with dosages. They also do drugs interactions. But what I really like about them is their decision points that they have in the notes and the videos that go with it. So let me tell you what that is about. So decision point. So it's a part of the app. So basically, for instance, it has all the different types of specialties listed: oncology, dermatology, neurology, cardiology, all those specialties, right? So say, for instance, you are looking to see how to start the right treatment for a patient. Now, this, like I said, again, this does not replace a real live person there, like your collaborator. It doesn't replace a coworker or anything like that. This is just supplemental things that you can have in your back pocket just to give yourself a good handle on different diagnoses and how to treat them, so that you're more on point with your clinical skills. But it's great. So say, for instance, cardiology, you want to know about heart failure. So it gives you heart failure, and it gives you like the diagnosis assessment, such as classification, clinical features, what diagnostic tests are needed, risks, the management of it, all the different types of heart failure. And they also give you little videos of someone basically talking about the topic. For instance, there is 64 videos on heart failure in here. It said they'll explain to you what the role in treatment and pearls are for digoxin. So these videos are really nice to look at, especially in your spare time, especially if you're working in like a specialty like cardiology. This probably would be really good and really beneficial for you, because then you can be more on point and get an idea of like an expert just basically talking to you about like what their take on different things are. But of course, you are going to use your own brain and do your own treatment and own assessment, but it's always good to follow the guidelines. And these aren't to replace guidelines, but they are basically guidelines in a nutshell. And that's helpful, especially when you're really busy and running around with 20 patients on your list to see today. So that is Medscape. So again, really good for articles. You get some CMEs, they pay you money for surveys. And I really like those, the decision points with the videos to it. And then they also have a pill finder on there too. So if you like kind of don't know what the pill is that a patient says, oh, I take this white round something pill. I personally have never really used any of these applications to try to figure out what a patient's taking. I call it pharmacy. But, you know, if it's something like you need and you're out in like a rural area, or you're maybe doing home assessments and things like that, you don't have access to a pharmacist, it could be helpful. Hippocrates has a pill finder as well as Medscape, and those both are free. My next free application that I like a lot is MD Calc. So I work in urgent care, and I used to work in the ER as well. So I used to have to calculate like anion gaps and stuff like that. So I love MD Calc, which is MDCALC in the App Store. It basically gives you all these calculators and guidelines and screening tools and calculation things that you can use. It's awesome. So with the MD Calc, this app is basically green with a plus sign in the middle, a white plus sign. So if you look at this app, it gives you, it has different tools in it. For instance, if you need to do, what's one that I use a lot? The asthma predictive index. So you have a patient come in the ER with asthma or some issues, or you have someone in primary care. Basically, it gives you these instructions to score the patient. If the patient is a pediatric patient or adult patient, so does the patient have wheezing? Yes or no. Parent with asthma? Yes or no. Parent with eczema? Yes or no. What are their prediction to get asthma? So this is a really good tool to use. It has all different types of calculators in here: BMI, BSA, the Bristol tool scale, the Brew criteria, the Cage questionnaire for like alcohol. Have you ever felt like you needed to cut down? People annoyed by your drinking, and it basically gives you this in a calc. Like, we used to have these tools like on paper at school, and now you just have it on your phone in a calculator. So it's really awesome to have. So that is MD Calc. And then my last app that I like a lot, because I worked in urgent care, is Sublux. So Sublux is basically helps you read X-rays. So this is awesome. It's let me show you. So it's SUBLUX. That's the name of the app. And it is like a blue background with an S and an X on it. But I love this because it gives you a tutorial basically how to diagnose fractures and dislocations of different extremities. So say, for instance, you have a patient coming in. A lot of times I used to look at the X-ray and I used to overread them or underread them, but this gives you good practice. So you can kind of see how things are supposed to look like and what things look like when they're out of place, and you can compare it to your X-ray. Of course, I always call the radiologist and ask them to read it to me. And how'd you come to that conclusion? Because I just want to know for my own purposes and for learning from other people, especially if I miss something and whatnot. And I'm like, oh, I didn't see that part. Oh, I overread that part when I read X-rays. But it's awesome because it gives you like the arm. If you want to look at a shoulder, it'll show you what an AP view of a shoulder is, what it would look like to ensure that it's aligned properly, and then what to look at, and it gives you different measurements, and it'll give you an example of what it would be like if it was like a dislocation or possibly a fracture. So that is an awesome app too, Sublux. So I hope this was really helpful for you guys, because these are 5 apps that I really like. They kind of go over everything that you kind of would come in contact with as far as clinical basis. So we have our UpToDate, which is a paid subscription, of course. That's good for diagnosis, treating signs and symptoms, things like that. We have Hippocrates, which is free, which is good for medications, the dosages and what they're used for, and how often to give it, for what duration of time. Then we have the Medscape, which is basically the one for articles, drug interactions and dosages, which Hippocrates does as well. That's the decision point with the videos. That's free as well. Then we have the MedCalc, which does your screening tools and all your tools that you'll need for all different types of things, from asthma to D-dimers and things like that. And then you have Sublux for your X-rays. There's one other app that I also like, a bonus app. I'm going to give you guys ICD-10. I know a lot of the EMRs have the ICD-10s already in the computer or system, but I used to use this because when I first started, we were transitioning from ICD-9 to ICD-10. So our EMRs were kind of still not up to date. So ICD-10, which is ICD-10 Console, I used to use this a lot. If you look in the App Store, if you would like to look into it, it's ICD-10 Consult, CONSULT. So I used to just look this one up. It gives you basically what the ICD code is for everything. So say if you're in a rural area and you're out there and you need to find out what the ICD-10 code to bill for a certain service is, it gives you all the ICD codes. It also gives you different a little bit of information about each of the codes and whatnot. But that was one other bonus app that I would use. And that one is a free app as well. So I hope this was helpful for you guys. If you have any questions, please feel free to leave them in the comments. I hope this was helpful. I'm sorry I couldn't show you guys what the app looked like. I'm going to be working on my YouTubing skills soon. But the information is valuable. I don't care, as long as you guys get something out of it. So that's all for Sunday. And if you guys want to reach out to me, be sure to like my page on Facebook at NP Now LLC. Also, make sure you follow me on Instagram at NP Now LLC. And you can find me and reach me on my website at npnowllc.com. And all that information is on my channel, okay? All right, thanks. Happy Sunday, and